afternoon, everyone, and thank you for joining us on our 125th Media Advisory during this pandemic period. I'd like to welcome Dr. Richardson, our Medical Officer of Health, and Jason Thorne, our Emergency Operations Center Director. And as you may know, the Board of Health met this morning, or this afternoon, in fact, followed by a special council meeting to repeal city bylaws on masking and physical distancing to be in alignment with the provincial direction that is commencing today and following the advice of Hamilton Public Health Services. It's important to note that under provincial directions, masks will still be required in some settings, including public transit, long-term care and retirement homes, and other healthcare settings, congregate care settings, shelters, jails, and congregate care and living settings after March the 21st. And so wearing a mask continues to be the effective way of public health measure to reduce the COVID spread of COVID-19. Some individuals may choose to keep wearing masks in place where they are not required, and others, such as those who are close contact of COVID-19 cases and those returning from international travel, will still be required to wear masks for a period of time. I'd like to encourage residents to continue wearing masks if that is your choice, as it remains an effective measure to reduce the spread of the virus. And I will be doing so, especially when I'm in areas with a lot of people. So our city continues to reopen city facilities and resume more regularly delivered in-person city services and programs. Many of our staff who have been working from home during the pandemic are returning to the workplace. This is a good sign and helps give life to the downtown core in many areas who are seeing an increase in foot traffic and activity. We have been working hard to ensure all facilities and municipal spaces are following all of the established health and safety measures, so we're able to protect those working in our workspaces or visiting to access city services in person. So staff working in municipal spaces will continue to do their daily health screening, and at this time continue to be subject to the city's mandatory COVID vaccination verification policy. And with that, I'm going to turn things over to Jason Thorne, our Emergency Operations Center Director, to share with us some municipal impacts as a result of these changes. Jason?
Thank you very much, Mr. Mayor. And I would like to provide a few updates today regarding the continued easing of public health measures specifically related to masking and physical distancing. As has been widely reported, beginning today, the province has indicated that face masks will no longer be required in schools, retail settings, and most other indoor public spaces. Settings such as public transit, healthcare facilities, long-term care homes, and congregate care settings will keep their masking mandates in place until April the 27th, at which time the province plans to end all of these public health measures. What that means for city services is that all HSR and DARTS customers must continue to wear masks while traveling on our transit service, and anyone visiting McCassel Lodge or Wentworth Lodge also must continue to wear masks under the provincial mandate. Today, Hamilton Council also voted to revoke the city's physical distancing bylaw and the city's face covering bylaws. So that means that any city enforcement going forward will just be focused on those remaining provincial regulations and guidance. As the mayor noted, I also want to provide an update on city staff's return to the workplace and the reopening of city offices and counters to the public. Beginning today, senior city staff, so that includes directors and general managers, are transitioning back to their city workplaces. Remaining staff will commence a phased and gradual return to the workplace starting on April the 4th. Those are the dates for the return of city staff. For any of our offices and service counters that are not already open to the public or that are open but at reduced hours, they will resume full service and full business hours starting on April the 25th. At this time, our employees will continue to wear masks while working in their city workspaces or while conducting city business out in the community. Now, our employees will be asked to continue wearing their masks until at least the end of April. We're also asking our employees to continue conducting their daily health screening as another measure to ensure a health and safe environment as our staff return to the workplace over the next number of weeks. The city's mandatory COVID-19 vaccination verification policy for city employees, which requires all city employees to be fully vaccinated, also remains in effect. We are in the process of reviewing this policy and expect to have more to share on that in the next few weeks and to bring a report to council in April regarding that policy. So with that, I will turn things over to Dr. Richardson.
Thanks very much, Jason. Good afternoon, everybody. Our COVID-19 health indicators continue to be significantly lower than what was seen during the peak of the Omicron wave here in Hamilton. Locally, our new hospitalizations and ICU admissions have declined, but have recently plateaued. There are almost 2 new hospital admissions each day on average and no new ICU admissions each day. These 7-day averages have been fairly consistent now for about the past month. Hamilton Public Health does continue to report deaths associated with COVID-19, but this trend is overall at a low. Today, we have reported no additional COVID-19 related deaths since Friday, March the 18th. Hamilton's rate of percent positivity has recently increased and is sitting at 15.6%, which is similar to the provincial rate overall. Our test positivity rate peaked in early January of 2022 at 29.8% for the PCR tests that have been completed and was below 10% at the end of February. In addition, when we look at outbreaks, the number of active COVID-19 outbreaks has been consistently low in recent weeks. Currently, there are 7 active outbreaks. 1 new one has been reported today since Friday, March the 18th. And the details, of course, on all those outbreaks can be found on our dashboard online. Just one point of housekeeping as it relates to the dashboard. We have now, as of tomorrow's data refresh, the reproductive number will be removed, which aligns with the ministry reporting here in Ontario and with the Ontario testing guideline changes that were initiated late in 2021. This is because the reproductive number can no longer be estimated accurately. When it comes to the community's uptake of COVID-19 vaccination, 87.4% of Hamiltonians 5 years of age and up have received a vaccine to date, and 83.9% are fully vaccinated. 53% of children 5 to 11 years of age have received a first dose of a COVID-19 vaccine, and 35% are fully vaccinated at this point. When it comes to booster doses or third doses, over 290,000 people here in Hamilton have gotten their booster dose, which means we have population coverage of 53.5% for those 12 years and over for whom booster doses are recommended. So with these trends in place, our community's high vaccine coverage rates, as you heard, there have been some changes being made to our letters of instruction. So you'll know that our letters of instruction in relation to vaccines were no longer in place as of the changes that were made in the regulation. And so those were taken down earlier this month. As well, effective today, we have rescinded the letters of instruction for those responsible for local high-risk apartment and high-risk condominium buildings that had been put in place back on July 12th, 2021. These, along with the bylaws that the mayor has mentioned, were temporary and necessary measures that were put in place in response to the ongoing pandemic. It is very important to recognize the sacrifices that many have made and the effect that the measures have had to protect our community against the COVID-19 virus, but then had corresponding financial, mental, and emotional impacts with all of these as we go forward. It is because, though, of these sacrifices that people have made that I extend my sincerest gratitude to all Hamiltonians for their willingness to follow public health measures, not only to protect themselves and their loved ones, but to protect the most vulnerable here in our community and our community's health system as well. This shared commitment has brought us today and another step forward in our transition to living and managing with COVID-19. In the weeks and months to come, what is required of community members is changing. Lifting masking requirements doesn't mean that well-fitting, properly worn masks are no longer effective tools or protections against the virus. Some community members will still need to wear them. They'll still be required to wear them because of the setting that they are in, like transit or long-term care, as you've heard Jason and the mayor speak to, or because of their health situation, they will be wanting to wear them, or because of the health situation of somebody that they live with or spend a lot of time with. And some Hamiltonians, of course, will make their own estimations and choose to wear a mask because they feel more comfortable doing so. When we talk about those high-risk settings where they are still required, they are public transit, long-term care and retirement homes, healthcare settings, shelters, and correctional facilities. And so those will be in place till the end of April when the final changes related to the Reopening Ontario Act come into place. Also required are COVID-19 close contacts of cases and those returning from international travel are still required to wear masks for a period of time. As we shift to sector-specific guidance and recommendations, organizations and individuals will have to make informed risk-based decisions about how to prevent COVID-19 for themselves and for our community. They may not be as aware of this practice given how long we've been living with mandates now for some period of time. And I'd like the analogy that some people use about the weather. And so most of us make a personal risk assessment each winter day that we go outside. Fortunately, it's not looking as much like winter as it had been, but we check the weather, decide if we need a hat and gloves, or we decide now that it's spring if we need an umbrella and a raincoat. And similarly with COVID-19, we need to be aware of the epidemiology in terms of our cases. Are they increasing? Have they plateaued? Are they decreasing? How are we doing with hospitalizations? We might look at where it is that we're planning to go. What is it we're planning to do there? Is it a higher risk activity that involves vigorous physical exercise? Is it indoors or outdoors? How crowded is it going to be where I'm going? Is it going to be well ventilated? How long am I going to be there? And then consider our own risk as it relates to that sitting and our family's risk, and whether that's something that we choose then to engage in, or whether we want to use other measures to reduce our risk, like distancing, masking, and those sorts of things. Of course, individual public health measures are most effective when they are layered together amongst other actions that we can take to protect ourselves, like being fully vaccinated, and that includes receiving a booster dose when it is a time that we're eligible for them. It does mean as well things like practicing in activities outdoors where we can, and of course, continuing to work on things such as ventilation. So while the transition that mandates these public health measures to recommendations and guidance is occurring, it does not mean that COVID-19 has ended. We do expect to continue to see COVID-19 activity in our community. We will continue to see some hospitalizations. We will continue to see people, unfortunately, have severe outcomes associated with COVID-19. But we are in a place where we can learn to live with it and manage it for our community and for our healthcare system. So we'll continue to engage with Ontario's Chief Medical Officer of Health. We'll continue to look at our local epidemiology, our provincial epidemiology, and indeed the epidemiology of COVID-19 around the world. We'll continue to monitor indicators for easing public health measures. We'll continue to have heightened awareness and talk to that as we go forward, as we speak to public health measures and when they might be needed. We'll continue to look and see if we do need to require those measures if we do see a resurgence in cases, which might happen, for example, if immunity were to wane and cases may go up then, or if we see a new variant come into being. And we all know globally, the best way we can prevent that from happening is to get global vaccination rates up as well. So we do know, of course, this continues to be a challenging time as we move forward as a community and look at how we take the next steps in managing and living with COVID-19. We know, of course, that some people are relieved to see that this transition is finally in place here in Ontario, while others definitely feel that it's too soon. We are in a very different situation now compared to earlier in the pandemic, and particularly in this Omicron wave, and when those mandatory public health measures were needed. Myself and my colleagues are very grateful for the community's commitment to each other, and together how we have done with all these tools that are now in our COVID-19 toolbox. We will be able to continue to live and learn together as safely as possible and make this transition into this next phase. With that, Mr. Mayor, I'll hand it back to you.
Thank you very much, Dr. Elizabeth and Jason Thorne, and thank you for all of your very dedicated and hard work throughout this entire process. None of it's been easy, and much of it's been difficult, and you've acquitted yourself extremely well as we work through all of these issues. And as we can see, as there's a gradual but cautious return to a pre-pandemic life, we must continue to follow those public health guidelines and remember that getting the vaccine and booster dose is the best way to protect yourself and your loved ones. So we know the pandemic's been difficult for many families in our community. We want to thank you, everyone in the community, frontline retail workers, service workers, healthcare workers, our public health teams for their tremendous cooperation in doing their part to get through this pandemic and keep one another safe. This community, by and large, has done the right thing to get us to this point today. And certainly there are measures that you would be encouraged to continue to take, like masking and like getting that booster shot, which is critically important. Maintaining some physical distancing if you're too close to others that you may think might be uncomfortable and might cause you to acquire COVID. So not all of that still applies, but of course your individual choices apply as well. So I'll now hand it over to Jasmine Graham for questions from the media. Jasmine?
Thank you, Mr. Mayor. We have 5 media joining us today, and as usual, we will start with 1 question and 1 follow-up for everyone. Our first question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much. I hope everyone can hear me okay. And it's kind of bizarre to think that we've been doing this for 2 years now, and now they're coming to an end, sort of. So this question, I guess, would be for the mayor and Jason, as well as Dr. Richardson, you can weigh in as well. I know you did touch on this. Is there a plan in place to quickly and easily re-implement the public health measures like masking if it suddenly appears that the situation is getting out of hand, or would it have to go back to city council and go through another debate? How would that work?
Likely would have to go back to council for another discussion and debate, but we have kept our emergency standing in place for the time being, just in case we need to move quickly on these matters. And our medical officer of health, Dr. Richardson, does have authority in some of these areas to also enact some policies should the need arise. So I think we will react quickly. If anything were to occur that would cause a spike or another greater concern for us to have to retreat back to some of the previous policies, we will react as quickly as possible. EOC, I think, is still based on that emergency declaration, still very much in place. And if they need to react, they can reform and meet quickly and also make recommendations as quickly as possible. But I'll leave it to Jason and Dr. Richardson to provide their own answer on that.
Yes, thank you, Mr. Mayor. And so the EOC is staying mobilized for now. And I think we have shown that if necessary, we can bring forward, if it's a bylaw for council's consideration, we can do that quite quickly. Similarly, if there's any future adjustments to any city services or anything like that, those are decisions that the EOC can continue to make in very short order if it's necessary.
And perhaps I might add, Lisa, that we have the frameworks and are ready here to take the steps that we need to take. But always thinking about COVID-19 and our experience with it has been that, what happens here in Hamilton is happening usually in the GTHA and beyond. And so we're also working very closely with our provincial colleagues, as I know the mayor would be and Jason would be, around what's needed and encouraging the view from a larger jurisdiction as well when it comes to many of those control measures.
Okay, thanks. And my follow-up would be, you've been mentioning during this briefing today, everyone has, that the mask mandate is ending in certain settings, but it's still remaining in place on public transit and high-risk settings as well. I'm just wondering if you anticipate there might be confusion among kind of the general populace that, there still is mask requirements in these places, not in these other places. I know that's been set out by the province, but do you think some people might still be confused? And also wondering what the city's plans might be going forward when those transit and other setting mask mandates are lifted. Will the city be following suit in those cases? And sorry, I guess that's for everyone again.
I'll take a first crack at it. So yes, you're right. The province has indicated a number of areas where the masking is still going to be required, but the actions that the city took today was actually to prevent confusion. It would have been very confusing had the province, which had already announced today was going to be the end of the masking from their perspective. Had we not followed suit here in the city, then we would have had mass confusion in our broader community. So this was really an effort to try and synchronize and follow the science, quite frankly. And we've said all along that we will follow the medical officer of health's advice, and certainly her advice today was that these are appropriate measures at the appropriate time. And so I think we're being completely consistent with what needs to happen going forward. In terms of what happens in transit, I mean, again, I think it's a matter of where the case counts are, and the province has mandated that we are required to have it in place for transit. I think it's the right step to take still. I would have preferred that the province would have waited until, after March break to make their decision in terms of the masking and physical distancing, but they didn't. And so today was an effort to try and actually synchronize with the province of Ontario, still based on medical officers' recommendation. Jason, Dr.
Yes, and I would just add in terms of communicating to the public. So we do have a number of public communications planned, starting with this media briefing here today around what those new requirements are, where masking is still required and where it is not. For the city services where it's still required, which is transit and our long-term care homes, we will still have signage in place. In our long-term care homes, we have had quite good success with the screeners that we have present to remind people of what the requirements are. So all of that would be continuing.
Great, thank you. We'll move on to our next question from Manisa from CHCH. Manisa, you can go ahead.
Hi, so my question is for the mayor as well as Dr. Richardson as well. The Hamilton Wentworth District School Board has chosen to extend and ask students and staff to wear masks. Do you support their decision?
I support any organization in our community that makes a decision in the interest of their organization or their business. There are many businesses that I'm aware of that have already decided they're going to continue with masking for a period of time. The City of Hamilton, for our own corporate entity, our staff internally, we're going to continue to require masking of our employees for the foreseeable future until such time as we're past the April. I don't remember the date, but Jason can fill in that blank. And so, any organization out there that feels more comfortable in terms of maintaining a masking scenario, I think can and should do so. And I think the school board fits into that scenario. And it is my understanding that the school board has independent authority to actually make that happen on behalf of their teachers, employees, and students. So I support that.
So perhaps I'll just add, Mr. Mayor, similar to what you're saying, that's our recommendations in public health, that everybody needs to go through this process of looking at their particular situation, what their experience has been, what their activities are, their organization is, and do on both an individual and an organizational basis, look at what they think is best for their settings. And so respecting that the school board has gone through that process and made a decision that they feel is best for them, and we'll continue to work with them and support them as they go forward in this COVID-19 journey, as we've done all the way through the pandemic.
Great, thank you, Dr. Richardson. Manisa, if you'd like a follow-up question, you can go ahead.
That's good for me. Thank you so much.
Great, thank you. I'll go next to Justin Chandler from TVO. Justin, you can go ahead.
Great, thank you. My question's for Dr. Richardson, just along those same lines as about the Hamilton Wentworth District School Board and their masking rules. My understanding is that Public Health decided not to go the route of a Section 22 order as per Chair Danko's request. And I'm wondering if you could comment on why you felt that wasn't the right path here.
Yeah, thanks very much, Justin, for that. When we look at the current epidemiology, we look at where we've been with this particular virus, and particularly during the Omicron wave, where we've seen very high peaks in terms of cases and hospitalizations and the like. What we look at now is that we're in a very different place from an overall disease level. And from a vaccination standpoint, we've got good vaccination coverage locally, and we've got decent coverage from a booster perspective, very similar rates to what we're seeing elsewhere in the province, and really seeing that there isn't a difference in terms of what we're experiencing here. We know that policy direction that is coming forward around these kinds of settings, the guidance that's coming forward is coming from the province. We're no longer writing letters of instruction under the Reopening Ontario Act, and really looking at how things have significantly improved, not seeing a circumstance that's at all different here in Hamilton. And so really no grounds to write a Section 22 order at this point in time. We do know that the Omicron variant, the COVID-19 overall, isn't going to go away, is what we're seeing, and that we're going to continue to have some cases. We're going to continue to have some low level of outbreaks in our community. And what we've seen in our schools is that our schools do reflect what's going on in the community. And this is where, when we talk about all these control measures, it's not that we're saying that they all should end. It's that we've just switched from mandates to choice around wearing them and making those decisions on an organization by organization and person by person basis as we go forward, and trying to balance the impacts of the pandemic's control measures and the impact of the pandemic itself. And so, as I said, we very much respect the process and the decisions of the board. Don't see a basis for writing a Section 22 order, but we will, of course, continue to work with the school board to support them as they're working through the issues related to COVID-19 and ensuring that the kids in our schools, the staff in our schools are well looked after from that perspective.
And Justin, if you'd like a follow-up, you can go ahead.
Sure, yes, please. This is also for Dr. Richardson. And it's just, I'm wondering what advice you might offer to someone like a teacher or someone in a business who's sort of in charge of maybe mediating a space where people are or are not wearing masks now and just wants to try and keep everyone safe, happy, and comfortable.
Yeah, it's a tricky time. And as a business, an organization, as individuals, we're all going to be going through this transition of understanding where we're at and going back to looking at the setting that people are in, and looking at all the factors that we know can increase risk and all the factors that we know that can decrease risk. And so thinking those through for a particular organization. So is it a crowded space? Is it an indoor space, an outdoor space? What's the ventilation like? Continuing to improve things like ventilation is very important in all of our settings. Vaccination, and continue to make sure we support people to get vaccinated, have the time to do it, make it as easily accessible as possible, and making sure that we support people to work through that process, not only as an organization, but as individuals within that organization. And then, really what's important too is this piece about we're in this together. This is not us against one another. This is us against the virus. And we will each take measures that that are suited to our own particular circumstances. For example, somebody who's just come back from travel is going to need to wear a mask. Somebody who's been a contact of a case is going to need to wear a mask for a period of time. So being respectful of those decisions, as well as those who are more comfortable continuing to wear masks, but then also respectful of those who choose not to do that. So really supporting that decision-making at an organizational and individual level is very important, with information, prompts, all of those sorts of things, and then being respectful of the choices that are made as we go forward. We know that relationships and community cohesion is as much a determinant of health as all of the other determinants that are out there. And so it's really important that we are mindful of that as we go forward.
Thank you, Dr. Richardson. Next question is to Aura from CBC Hamilton. Aura, you can go ahead.
Thank you, Jasmine. This question is for the mayor and Dr. Richardson. Thinking about masks and the fact that they mostly protect people around us, what message might you have for those who may feel like their health has been devalued over the health of others? Are you expecting the lifting of mask policies to be felt among some groups more than others?
Yeah, I suspect so. And, certainly those folks that are, immune challenged or have underlying healthcare issues are ones that likely them and those that are around them should probably continue to mask. And I think that'd be respectful for all of those individuals in our community. There's no easy answer to, how do you go into and how do you go out of the pandemic and the whole masking scenario and the physical distancing scenario. It's at a given point in time, you have to make a decision to move forward. And today, I think this council decided to mirror what the province has already indicated they're prepared to do to try and avoid confusion. But I would certainly ask anyone that is associated with anyone that has health issues or immune challenges or are older, of course folks that are 60 plus are more vulnerable to the virus, that you might want to think about maintaining masking in their presence or for their benefit or for them to wear masking when they're in other people's presence as well. So I think that's a consideration that people will have to go through, and we still continue to highly recommend masking as a great way to avoid getting Omicron or to avoid spreading Omicron. So it's still very much a part of the thought process, and I think Dr. Elizabeth can answer maybe a little bit better from a science perspective, who's vulnerable and who's not.
No, thanks very much. I not a lot to add, Mr. Mayor. You covered most of it. I would just add a few things. Is just the importance of staying home when we're sick continues to be very important. I would say that we used to have a bit of a feeling of bravado of if it's just a cold, come on, come do it. But we really need people to pay attention to those things and not, come in, spend time with others, whether it's in a private setting or it's in a business or it's in their workplace. We need people to stay home if they are sick. The masks do provide some protection both ways, in terms of spreading the virus, and the better the mask, the better fitted it is, the better quality it is, the better it's going to do in terms of that. And of course, we've got the recommendations around wearing 2 layers of masks helps with that as well. And I think the other piece about vulnerable people, we know from a determinants of health perspective that there are people who are more vulnerable. The data from the science table plays that out. It's continued to be the case throughout the pandemic, where people who are more vulnerable have higher rates of disease and lower rates of vaccination. And, it's really highlighted those issues for us to consider in society as a whole. And it doesn't matter whether we're talking about COVID-19 or we're talking about diabetes or whichever it is that we're talking about, those inequities happen right across the spectrum. And I'm, very hopeful that highlighting these pieces for us all has given us pause and reason to think more about the social determinants and what we can do to improve health inequities right across the board.
Thanks. And Aura, if you'd like a follow-up, you can go ahead.
Yes, sorry, I had issues finding my unmute button, but my next question is also for Dr. Richardson. I was wondering if you could share with us the reason why the city has published the wastewater data, and what do you think the public can take away when looking at that data?
Yeah, thanks, Aura. It took us some time to get that particular piece of the data up on the web, but it is up there now. And we do try to be, have as much of the data that we have go through to the web, be publicly available to everybody as we go. And so that's certainly one of the principles we've tried to operate on. When we're looking at it, it is still a measure that is being studied, still evaluation being done on it, but it is a promising one as we go forward. It is one of many indicators that we are tracking. So we continue to look at case rates. We continue to look at hospitalizations and ICU and deaths as measures of severity. We continue to look at percent infected, the positivity rates on those that are tested. So we continue to look at all of those, the number of outbreaks that happen and in what settings. We look at those as a whole suite of indicators around what is going on with COVID-19 in our community. And so we'll continue to look at how the wastewater signal might act as a bellwether for what's happening otherwise, and very much look forward to the work that continues to be done by the Ministry of Environment, Conservation and Parks and the University of Ottawa as they further explore this and how it fits into our COVID-19 plan overall.
Great, thank you, Dr. Richardson. Our next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the questions. Dr. Richardson, can you talk about whether you will continue yourself to mask after today, and where and why?
Yeah, thanks, Joanna. I appreciate the question. And absolutely, I'll be using my mask at times. I will particularly be using it more so in indoor settings. Be considering too the kind of event or activity that I'm going to, whether, we've seen particularly with things that have that, higher breathing rate, the sports events, that kind of thing. Where we can have increased transmission. So be considering those kinds of factors related to it, be considering, how crowded it is at a given time, and thinking not just of a mask and when and where I'll use it. Of course, I'll be using it anytime I'm on public transit or when I'm, visiting a long-term care home or anything of such a nature. But I'll also be thinking about all those other measures I can take as well. So, I am triple vaccinated. I will be looking to see what the recommendations are around boosters to see if another one is recommended as we come into the fall. Continue to think about physical distancing in terms of how that fits in as well. And, I still deliberately make choices about just how many things I'm going to go to and how many contacts I'm going to have. And so all of those sort of factors come into it when I'm thinking about what kind of approaches I'm going to take to reduce my risk of COVID-19.
Thanks so much. And you talked a lot today about people having to make their own individual risk assessments and compared it, to, whether you wear a coat and things like that in the winter. But I mean, it's pretty easy for me to see what the weather's like outside. Not a lot to ask the public to know the epidemiology of COVID, to know what hospitalization rate is for COVID in the community at any one time. Is it not quite a bit to put on the public, especially considering that scars and forecasting today showed public health measures like masking could literally save us thousands of cases and a large number of hospitalizations between now and the end of May.
Yeah, thanks, Joanna. I think it is challenging for people to pay attention to all the details all the time. And that is something that we're quite mindful of as we do our communications work as we go forward over the coming weeks and months to make sure that people have as much access to information as possible. Absolutely no doubt that if things change, you'll hear us speaking to those if there's any sort of significant change that comes about in terms of the epidemiology. You'll certainly hear from us if there's a new variant that's being explored and what that might mean as we go forward. So we'll keep up on the communications front in terms of that information, but it is all there and available to people as we go forward. What you saw in the scars and forecasting today was trying to illustrate, much as the science table actually did last week as well, was as Ruth was preparing those slides, she was rather pleased to see we'd done them in a similar way. That what it tried to illustrate was just the range of potential futures as we go forward, and that based on the choices that people make, you can have an impact, you can have an influence on what that range is going to look like. So we are very much continuing to encourage people to make that choice around looking at those factors and considering wearing masks in indoor public places, in crowded places in particular. Continue to look at the number of contacts that you're having and be thoughtful about that as we go forward. Really, it is through the collective actions of all of Hamiltonians that we've made the difference in terms of bringing rates down. And ultimately, it will be what makes a difference in keeping those rates at a low level as we go forward. The one thing we do know is it's not going away altogether. And so we're going to continue to have a more significant level of activity than we did with this particular variant than we did before this variant. And so we really do need to figure out how to best live and manage and thrive even in the presence of COVID-19.
Great, thank you very much, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Thank you very much, Jasmine, and thank you to our media partners out there for continuing to share this important information with the broader community. Today marks the 125th COVID-19 media briefing, and it also marks our last regularly scheduled briefing. So moving forward, we're going to continue on with ad hoc media briefings if and when we have announcements to share related to COVID-19 response. So I want to take a moment to give a very special thank you to Jasmine and for continuing to moderate these media episodes for 125 of them, in fact, as well as to thank the entire communications team and staff in my office as well for their support in creating these briefings. And of course, a special thank you to Bill Custers and the entire team at Cable 14 and Clear Cable. I know we say that each and every time, but these are not easy broadcasts to put together, and you've made them effortless and seamless, and we really appreciate the effort you put into making them happen for the benefit of the community at large that has had seamless access to these briefings, and that's been just incredible. Thank you as well to Rosalie Vizers and Georgia Whalen for your ASL interpretation throughout the briefings. Members of our deaf community have been greatly benefited from your interpretation. And I'd also like to thank Jason and Dr. Richardson and the other key spokespeople who have been along with us for the entire time. Previously, Paul Johnson, and from time to time, Grace Mader, Edward John, our partners in the hospital and family health teams and community all have participated in these briefings and have provided, I think, very, very useful information for the community and for the media at large to help us work through these very, very difficult, challenging issues. And finally, a very special thank you to those media partners I mentioned a little while ago, but to all of you in the broader community that have been paying attention and doing the right thing and helping us, the community, helping each other through this very important pandemic period. It is not over, and clearly it's something that's going to continue, but in a different way. And we've got very, very many more people vaccinated, and that's a very positive thing. We encourage you to continue to go get that booster shot. And we will definitely continue to share information as needed with our media partners and on the social media and on our website and more. So we're not going to stop sharing this information, but we are going to pause these media briefings until a future date when they're necessary once again. And hopefully that isn't for a long, long time. So in the meantime, to all of you out there, continue to follow all the public health measures and get your vaccine, get that booster. It's very, very important. And if there's a fourth shot that comes along that some of you have had already, especially those in our long-term and retirement homes, take that as well. It is the best way for us to combat this virus. And in the meantime, keep each other healthy and safe, and look forward to talking to you in the near future. Thank you all for today, and thank you for everything in the past. All the very best.